Namaskar. I am Dr. Mahantesh Charatimath, Senior Cardiologist, Tathagat Heart Hospital, Bangalore. We are living right now in very critical, unprecedented time. COVID has spread all over the world and it has caused one of the greatest pandemicity in the history of the world, that too in the history of the health. There are more than about 5.7 million people suffer from this disease in India, and out of which more than 90,000 people have died. And in Karnataka, nearly 5.3 lakh people suffered and also recovered. Out of that, about more than 8,000 people died because of COVID. So it's a very critical time, all of us, and we need to take care of our health, and by taking care of our health, we can take care of our country and state. So this corona journey started in Wuhan in November-December 2019 and spread to the more than 200 countries all over the world within a short of span, causing pandemicity. And we are all aware that it has caused huge healthcare havocs, healthcare issues and problems in Europe and in America. So in India, because many people stay in rural, more than 60-70% people stay in the rural side, and about 30 to 40% stay in the urban setup. So we got our limited resources regarding our healthcare delivery systems and healthcare professionals are concerned. So this is very important in prevention of this disease rather than going for the treatment. And we are all aware that there are various special groups which are highly vulnerable in this critical time. The people or the special groups which have got more impact due to this COVID are especially people with a heart disease or cardiovascular problems, diabetes, hypertension, lung problems, cancer problems, kidney diseases, and old people more than 70-80 years. So these people, if they get affected by this virus, they show high mortality and morbidity. So this is very important for all of us to care of that special groups and also to see that this disease get prevented so that virus will not get entry into such special population. So in this, earlier we thought corona is causing only lung problem. So it's not only lung disease or lung problems it causes even various organ involvement, especially heart, kidney and liver and brain. So it can cause various kind of heart issues in a people with a corona or COVID. So it can lead to more heart attacks, heart problems, heart arrhythmias and sudden death. We started noticing that the people having a recovery from the corona having a sudden death after discharge or after going home. So heart can get affected by various ways in corona. So it can have a direct impact and it can have an indirect impact from the corona infection in the body. So by involvement of the lungs, so it can cause lot of stress, lot of strain on the heart. So it can put a more load, more demand on the heart. If already patient having a weak heart, it can worsen the symptoms or it can worsen the problems and it can push them into heart failures or sudden death. So virus also can directly affect the heart. In one of the German studies, about 78% of people get directly virus involvement of the heart. So they have done cardiac MRI studies to know the virus impact on the heart. They noted that virus can get involved directly in the myocardium in 78% of the people. So directly it can cause myocarditis, it can cause interstitial edema, interstitial fibrosis, and it can cause the heart failure. So it can make the heart muscles to go for the it can become weak and it can push them into heart failure. So these are the direct effect, indirect effect, and also indirect effect. So this COVID virus can cause like increase in the clotting mechanism in the body. So it can make blood clot happen in the blood pipes of the heart and also in the brain and also anywhere in the body or in the legs or in the hand. So because of this blood clotting, if it happens in the heart, people can get heart attacks. So people can get heart attack and can die suddenly also. So by having an impact on the blood clot, and also it can make the blood block, the blockages which already there existing in the blood pipe of the heart can become weak, they can get ruptured. So they can lead to initiate and lead to blood clot formation and can lead to heart attacks. So it can cause heart attacks, it can make the heart weak and can make the heart pump failure or heart failure, and also it can cause the heart rhythm disturbances. So it can cause bradycardia, ventricular tachycardia, ventricular fibrillation, arrhythmias, people can die suddenly also. So some of the medications which can be used to treat corona also can have an impact on the heart. For example, SUQS, the chloroquine and azithromycin and amiodarone, which can all cause the QT interval prolongation. People who have got a QT interval prolongation can go for sudden arrhythmias. They can die suddenly. It can cause ventricular fibrillation or ventricular tachycardia. So some people also nowadays showing bradycardia also, heart rate going down 30, 34. So these are the things which can come because of corona infection or COVID disease in a body. So heart has become very important target for the coronavirus. So this is very, very important, and we need to go for regular checks, and we need to go for regular, like to prevent this intensity or the serious, the criticality of the illness can be reduced by maintaining our health, the heart health, by taking regularly what are the medications which are prescribed by the doctors, and by doing a regular health check and going for a regular exercise, and we need to take special precautions also. So in a COVID or corona patient, if heart patients are there, we need to give blood thinners, anticoagulants. So this is very, very important, and we need to take double precautions or extra precautions in a people with a heart issues. So this is very important. This is how the virus can get multiplied even in the heart muscle also. So because of this, even people are throwing into different kind of the heart arrhythmias, and also which can make heart failure. Already people are having a lung issues, lung are become very bad. In such patients, if heart becomes also weak, then the mortality and morbidity increases. So this is not only an issue with a person or patient, which puts a lot of the burden on the healthcare delivery systems, on the cath labs, on the cardiologist, and also on the ICU, and on the doctors, and also paramedical staff, and all supportive staff and system. So this the COVID or corona has more mortality and morbidity, and the severity of the illness is more in such kind of people. So I request all of you to take precautions by maintaining what all the recommendations done to prevent it. So it could be social distancing and frequent use of sanitizers, or maintaining the cleanliness, neatness, not only in home and in our surroundings and the environment, and also the use of steam inhalation, and also hot water drinking, and certain medications which are prescribed by the government of India, like the ivermectin, zinc, vitamin C, vitamin D, to boost our immunity, and also to if required some antiviral medications as indicated by the healthcare system, or doctors, or the hospitals, or from the preventive healthcare system of India.